Art Nezer. This is Chris Maguth Nezer. On behalf of AABT, the Association for Advancement of Behavior Therapy, we want to welcome you to the Archive series. The Archive contains a series of interviews of individuals who have made significant contributions to the fields of behavior therapy and cognitive behavior therapy.
The Archive series actually highlights the founders of AABT, as well as many influential thinkers in this field. This field is marked by empiricism as a way of determining what clinical interventions and techniques would be most beneficial in guiding the treatment and improving the life of many patients and clients. Additionally, it's guided by an empiricism for efficacy of educational programs and linking science and practice.
As you know, Chris, these interviews are kind of a double treat for everybody because both the subject as well as the interviewer are individuals that made significant contributions to the field. And in fact, as people will see, many of these individuals have made significant contributions to our profession, AABT, in terms of the growth and its progression. And AABT, as you know also, is the discipline's largest membership audience.
Yes, that's true. And hopefully, as you will notice, many of the interviewers, as well as their subjects, were chosen because of their collegial, long-standing, and often affectionate relationship with each other. Now, there's all types of relationships. And in some cases here, the interviewers were actual students of their subjects. In other cases, the subjects were mentors who guided them in other types of clinical training. However, in all cases, the interviewers were profoundly affected and influenced by the work of these distinguished individuals.
Right. I know we really enjoyed the interviews, and we hope you will do as well. At the conclusion of this interview, we'll provide you with a lot more information about our association, AABT, especially in terms of the benefits and the services that it can provide. In addition, we'll provide you with more information about how you can actually order different tapes in this ever-expanding series on the archives. On behalf of Chris, myself, and especially AABT, we wish to thank you and hope you enjoy the tape. See you later.
Hello, my name is John Lutzke. I have the honor and pleasure of interviewing my friend and colleague, Dr. Nathan H. Azrin. Dr. Azrin received his BA and MA from Boston University and his PhD from Harvard. Among his countless distinctions, in 1975, the American Psychologist designated Dr. Azrin as among the top 100 cited psychologists. In 1998, AABT gave him its Lifetime Achievement Award. There may be no other psychologist who has published applied empirical work in such a wide array of topics as Dr. Azrin. Let's hear a little bit more about him. Nate, how did you come to study for your PhD under B.F. Skinner?
Actually, well, that was at Harvard, and contrary to what one might think, if one goes to Harvard, that one went for the prestige of the institution. I specifically went there because Skinner was there, and wherever it was that he happened to be, if he was somewhere else, I would have gone to that place. It was a very, very crucial time in my life. I was at Boston University. I had finished all of my coursework, all my requirements, the major exams, qualifying exams in this field called personality and social psychology. And at this very young age, at about 22 or so, I was about to receive my PhD. I had only my dissertation to do, which I didn't anticipate taking very long at all. And suddenly realized that, well, is this what I want to do when I grow up? That I'm specializing in child psychology, among other things, and one of the things that one is expected to do if you're a child psychologist, of course, is to give advice to parents as to how to treat their children. I hadn't the vaguest idea that what I knew from the literature were all types of theories, all types of correlations about what happens at different ages and stages, and realized that I had perhaps chosen the wrong field for myself. Well, it was about that time that I became familiar with Keller and Schoenfeld, in which they outlined learning theory as a basis for generalizations regarding human conduct. And along the same lines, they were very influenced by readings by Maurer, Hobart Maurer, who did these wonderful scholarly and experimental studies with animals and generalized about how this might give general rules of conduct, and by Sears and Neil Miller. And so my leanings were in that direction. By coincidence, I happened to be working half-time on a project at the Boston University Medical School in the same area as Og Lindsley. Og Lindsley was a student under B.F. Skinner at Harvard, which was just across the river from Boston University. And we talked a good deal about how the type of Kellerman-Schoenfelder learning theory might provide a broad conceptual framework to go to organize what we knew about human conduct. Well, to go into, as a test to myself, I decided, well, in this course that I had in which it was required that you do a term paper or a project, I decided I'd do an experiment which put this to the test, and that is, what happens if you took some of the central concepts of learning theory and applied them to human conduct? Remember, at that time, there was nothing. There was nothing at all. There was no study that I could go and base any decision on. And so Og Lindsley put the equipment together for me very, very graciously. And I did this study at this local settlement house where actually I grew up. I went and visited, and the same fellow was there who was the head of it. And he said, sure, you want to do research? That's wonderful. And so I selected some of the roustabout children that were fighting and arguing and hitting each other and asked them if they take part in this study and what was in it for them. Well, jelly beans. That was what I was using as the reinforcer. And I did this study with them, and I did it with subsequently was called an ABA design, that is baseline, then treatment, and then baseline again. And it was fantastic. It was these children that had been fighting and calling each other names and being very difficult with each other during the period of this reinforcement for cooperation. They were just focused entirely on synchronizing their conduct with the other and giving each other advice as to what to do in order to come up with a cooperative response. So I applied to Harvard. That did it, which meant I had to start all over again in my doctoral work. And so it added several years to my doctoral work, but I was still young. As I said, I was only 22 or so at the time. And I have no regrets about that. And so I transferred to Harvard, and specifically because of Skinner, and worked pretty much exclusively with Skinner while I was there.
After you got your PhD, you then went into the Army, and then you took a position in Anna State Hospital in Illinois. What attracted you to those positions?
Well, the answer to that question are really antithetical for each of them. In the case of the Army, what attracted me there was really a compulsory draft notice from the Army saying that if you don't go, you will be imprisoned. And so I went into the Army. I was very fortunate. They assigned me to a human engineering laboratory rather than sending me up to some outpost in Alaska or the confrontation line that existed at the time in Berlin with the Russians. So I was in the Army, and that was wonderful. See, this was the era of Sputnik. Sputnik occurred in 57. Mm-hmm. The United States suddenly realized that it was behind rather than ahead of the rest of the world with regard to research. And therefore, on all fronts, including psychology, research funding came forth in bountiful amounts, and they were looking for people to do research. So in any case, the human engineering lab that I was assigned to in the Army, they just welcomed me with open arms. It was rather strange. I was a PhD private. And so any visitors came to visit this headquarters for ordnance in the Army, from visitors from overseas, and I was the place that they always visited to go and show the high caliber of the U.S. Army, that they had PhDs as privates, as enlisted men. Well, that's really an aside. The thing is that while I was there, I asked for and received an animal lab. I set up an animal lab there because what I was still interested in what were the fundamental principles of learning that now could go and give conceptual unification to what we were doing and asking about with regard to human conduct. So I set up an animal lab, but then I also did some work on some areas of applied concern to the Army and to ordnance, and that is studies on noise and fatigue and on vigilance. And that really constituted a beautiful transition, that I had the animal lab going at the same time where I was doing studies also with noise and for the analogs of these other studies on effort and fatigue. And then when I left there, I now had to obtain a position elsewhere, and it was in the middle of the academic year. So unfortunate, it was in January that I was discharged. Of course, the academic year starts in September, so there were not that many academic opportunities that would be open in the middle of the year. There was one. I had 3 opportunities. One of them was a small, very distinguished private university. And as they said, you can do all the research you want, but you had to raise your own money, of course. The other had research funding available, and that was with a very, very distinguished psychologist, and meant that I would be his assistant. And then the third one was Anna State Hospital, and actually Og Lindsley was the one who put me in touch with that. And they were interested in starting a research laboratory, a research program at that hospital. And there was no promise of how much money there would be or anything of the sort. Simply, they did say they would buy me the equipment and animal cages and animal facilities and relay racks, that is programming equipment. In terms of personnel, it was one assistant who doubled as the laboratory caretaker and as the secretary and as everything else. So there was virtually nothing. But unlike the other positions, it did promise the opportunity of being solely responsible for one's conduct and for having at least potentially the opportunity to go and to do research as your principal objective and your own research, and not as an aside, as is true in academia. So that really worked out beyond my wildest dreams. I think it's a research person's paradise. I'm sure if you were in there, you would have accomplished far more than I did. It was unbelievable. Even though they started off with this very grim budget, the work that I did there turned out to be sufficiently appreciated by them so that they expanded it. And when I finally left in 1980, this is about 20 or so years later, well, more than that, I arrived there in 57, 58 to 80, so about 23 years. When I presented my budget each year to the research directorships, there was once a year meeting, it was the same question, and that is, Nate, can't we give you more money? And that was true every single year. I had all that I wanted, and I didn't have to obtain their approval for my research. It was entirely my decision. I had to, of course, have it approved at the local level in an informal way with the superintendent and all. But the superintendent was not a psychiatrist. The superintendent of the hospital was a former general practitioner, and so he had a very functional outlook. Whatever it is that's for the benefit of the patients, and he had no particular conceptual orientation that he was opposed to or favored, and that was wonderful. And that is, he was interested in outcome. What's best for the patients? What is it that would be best for science in terms of advancing things? So it was just a wonderful opportunity, and so that's why I could that's why I could very intensively go into so many different fields. I didn't have to ask anybody.
Including, obviously, your animal work. It was a state hospital with mental patients, and you did considerable animal research. How did you pull that off?
Well, I was able to persuade them, and it wasn't at all difficult. Remember, this is the age of science, that science holds the key to the future toward opening up space. Tranquilizers had just been developed, and everyone saw that basic research could lead to very, very long-term revolutionary techniques in treating mental patients. And so everyone was very receptive to that. So I had animal work going on at the same time, and was studying many of the things that turned out to be general rules and applying it to human conduct. And that is, what's the effect of alternative response situations as opposed to single response? And that is, if you applied even a mild punishment to an alternative response situation, it had a large effect. Or to put it in more lay terms, if there's only one way of obtaining things, then punishment will have very little, punishment of your means of obtaining it will have very little effect. But you have several different ways of obtaining it, and even the mildest punishment will have a very strong effect, which meant, from an applied point of view, provide alternative responses. That if the individual has only one way of obtaining attention or obtaining satisfaction, then teach an alternative, and that will make even the mildest punishment effective. And also, The studies with animals were just so exciting. Some of the things that I developed, found there were just unbelievable. The thing that I'm the proudest of is this one on this pain aggression. You want to hear about that? No, here, I'll stop. You have other questions.
Well, very much related to that, how important was your animal work in conceptualizing all of your flight?
Oh, totally, totally. In a general sense, it laid down general considerations, and that is standardize your procedures. When we set up an animal schedule of reinforcement, I was constantly checking the equipment. I didn't trust anything. I would be constantly looking in the animal chamber to see, and very often the lights would be blinking or something would be erratic. You never could trust the instrument. So I oddly enough, even though it was all instrumented, I had a window, one-way glass there in the animal chambers, and would constantly be looking in there to make sure that things were operating as they should. And then response specification, went to great lengths to try to select responses that could be objectively recorded. Always quantification. You don't just say somebody's doing well or doing badly or he benefited. You give numbers and so that you can express it. So, and in terms of experimental design, that whatever you use, the individual subject design was there, the AB, that is no treatment, then treatment, to use the analogy with the human low. So these were the general considerations, but then there were the substantive things, and that is what were the principles of conditioning that we're talking about. And there, the enormous power of reinforcement. That was just amazing. I could take a pigeon, a naive pigeon just arrived from the animal supplier, put him in the animal chamber, and I would time it. In 60 seconds, I would have him pecking away at a key, working away at a schedule. It was just so powerful. Things were so dramatic, and also at an extraordinarily high rate, as higher rate, 3 per second, 4 per second, for hours at a time. And so you could see the power of the procedure, but the basic principle being that of reinforcement, the type of reinforcement, the immediacy, the question of what stimuli it was associated with, and most importantly, as well as with its absence, because it turns out that took on aversive properties. And that was where the whole notion of timeout came from. The schedule of the reinforcement, also what is it that aversive stimuli do, when is it that they're essential, and how do they compare with other operations. So all of those things were, so when I approached an applied problem, those are the things I thought of. What are the responses that are available for obtaining it? And what are the alternatives that can be taught? What are the responses that can compete with it, in other words? And in terms of aversive stimuli, went and found its effort. I had found that in the human engineering lab, and that effort itself was an aversive stimulus. You have to use shock. You don't have to use pain. That effort in itself is time out, just simply the absence of it. And so all of those things, so that some things occur in general issues, that is general methodology and the scientific orientation, empirical validation, not speculating about things without having the empirical validating or supporting evidence behind you. But in addition, these specific principles. And I ran them at the same time. Isn't it as if I had a cutoff point? I had the animal work going at the same time. And you did too, didn't you? When you came to Southern Illinois University, did you have animal work going on? Or had that?
No, the animal work had gone by then.
That had, oh, okay.
Now, you and Ted Ione at Anna State developed the token economy, which is used in families, schools, institutions. How did that come about?
That was wild. I was at a state hospital, and so there's obviously a population of patients there, but there was no pressure at all by the superintendent of the hospital to do anything with the patients. He left it entirely up to me, and so did the head of the research people in the state capitol. I was the editor of JAB. I was a chief editor, and one of the articles that I reviewed was by Ted Ione, and it was the behavioral. He was a psychiatric nurse, I think it was, as a behavioral engineer, and it was applying rather simple reinforcement procedures to clinical type problems in the context of a chronic ward of mental hospital patients in Canada. I think it was Ted's dissertation. That was so impressive. I had already been doing some work with humans. I was working with stuttering, and it was, but I read that and said, isn't that fantastic? But rather than simply trying it out on individual clinical projects, how about doing it on a widespread basis? And the entire ward. And what that meant is really designing an entire society, because this is where people spent their life, and that is to try to create a society that would be maximally reinforcing of behavior that is pro-social and constructive and adaptive. So it was actually a Walden tool. It was, how do you construct a society? And it meant that you're faced with all kinds of problems. How do you individualize it so that individual preferences and desires will be there? How do you devise it so that the constructive behaviors that one needs in order to function in a society, in that particular society, would be there? And what could you do to go into that would mitigate against the symptomatic behavior? Well, so it was designing a society, and I can go into the details of that, but you're right. It was starting from scratch. It was a grand vista, and I got okay from the state. The research atmosphere at the time was so strong, though, that when I presented that proposal to them and said that I wanted to start this program, they refused to fund it and said, no, that's not research. That's service delivery. Okay, it's only words. I rephrased the proposal and said that this is now going to try to apply learning principles on a group basis rather than the learning basis in which they traditionally have been studied and then went through. Well, in any case, so then I hired Ted Ione, and he was the clinical director of that ward. We got together every day, talked over what was happening and where we wanted to go. And it wasn't a quickie study. It was something, the procedure evolved. It went for 5-6 years. Neither of us ever thought of publishing. The idea was to perfect it. And that's very much how I've thought about other problems, and that is forget about publications. Number of publications is irrelevant. It's what treatments have you developed that are effective. And so we kept developing it until we thought it was really effective. That raised the question, then how do we present the results scientifically, because you can't show the introduction of the procedure and what effect it had, or have a randomly assigned control group. We only had one ward. And so what we did is we used the withdrawal type of design, and as we pulled out things, that is discontinued reinforcement, use only instructions instead of reinforcement, and things of that sort. And so we used the withdrawal design to go and to ascertain the extent to which the constructive functional orientation of the ward was really there, rather than using the traditional experimental design. And that's been a general rule. I don't worry about experimental design. I let that suit the problem. Develop something first, and anyone can think of an experimental design to go into to visualize the obvious, right? It worked.
I think that comes out clearly in the book, The Token Economy, which I've always thought is more than a guide to how to start up and run a token economy, but really is a guide to scientific behavioral logic.
Well, yeah, I'm delighted that you got that out of it, because that's certainly what we did. And that is, rather than just describing the final product, what we did in writing the book was going to develop the thought process. How do you decide on what behavior to deal with? And traditionally, when you're working with clinical psychology, the obvious thing is to deal with the clinical behavior. I said, no, we're not going to do that. That the clinical behavior is, again, deriving from the animal studies, is very often symptomatic of other deficits that are occurring, primarily, very often, simply the absence of sufficient reinforcement, motivation for other types of behavior, or inadequacies of learning, or some inadequacies in the social environment that's leading to it. And so the basic formulation there was, first of all, to not use aversive stimuli. I'd studied enough of it in the lab to know this pain-aggression phenomenon of the terrible emotional effects that it can have. But at the same time, to know that some type of aversive stimulus, some type of negative consequence is necessary. But if people are mentally ill, the last thing in the world they need is more pain under the guise of that being a treatment. And so what we use is simply some mild response cost, or simply postponement of the opportunity to obtain reinforcement, that if you're exhibiting symptoms, then you couldn't engage in the different tasks that would be earning you reinforcement. There was an intrinsic type of consequence. It didn't require any type of special programming. So we had only two, in fact, with response cost, we had only two categories of behavior that we had to this negative consequence of subtracting tokens on, and one of them was aggression, physical aggression, not verbal, but physical aggression, and the other was lighting a fire, smoking in bed in particular. But that was it. The things that were really life-threatening, and aside from that, the emphasis was on positive reinforcement. If you ever visited the lab, that token economy, I think that was gone at the time that you came to Southern Illinois University. Then, when you came there, we wouldn't show you around. A patient would. And that's how the ward was organized. Because one of the questions was, what responses do you maintain? Which we translated, what are the desirable things in life? And what is it that has to be done? And it was very easy to do then. That is, what is it that's necessary to keep the ward functioning? And not only self-care skills and household responsibilities, but also there were people there who served meals, who cooked meals, who performed as hairdresser, who acted as a tour guide, who answered the phone, who worked as a secretary. And so we had them all doing those things, and lest you create the false impression that this was sort of indentured servitude, it wasn't. We rotated the people from one job to another, so one person would never be indispensable. They played a major role in selecting which they wanted. They decided whether they wanted to do it. We didn't. And they always worked under the supervision of an employee, so that even if they didn't do anything, the employee would be there to go into the... So that was very, very, very exciting. And before we published it, people began imitating it. We had people coming in to visit us, and that's why we suddenly decided to publish. That people went back, looked at it. People came to visit us and looked at it, went back to their own place, and then a year later published an article on it. And it wasn't that they were being devious about it. All of them begged us, don't you have anything in print, anything we can cite? And again, Ted and I were very much interested in developing something new and different and effective, and we're not going to rush into print for the sake of a publication.
The book was truly amazing. I think you've alluded in part to what I'm about to ask you, but your chapter with Holtz in 1966 on punishment was defining and seminal. What role does punishment play in your work today?
Well, I started working on punishment right in my dissertation. I realized that was a big vacuum in the field. So much had been done regarding rewards, but in terms of punishment, it was very fragmentary and very theory-driven. That is, punishment is bad, and all the studies were done almost with the prior commitment to demonstrating that punishment was something that we should drive from the face of the earth, and that it was ineffective. It really didn't, all these generalizations that it may be effective initially, but it doesn't last. It teaches you what not to do and what to do. But those were all statements that were not based on the data. These are the type of speculations that I left Boston University to get away from. And there's what does the data say about that? Well, surprise, surprise, in doing the animal studies, it's the most effective procedure there is, probably short of decapitation or sedation. If the punishment is intense enough and immediate and specifically delivers with a response, then it only takes one or two deliveries to totally eliminate it. And Lobas's work later with autistic behavior, self-injurious behavior, showed that. So it's enormously effective. Well, it turned out there are some other effects that may make it undesirable, but they're not the effects that people cited, and that is that that the effect does not last. It just certainly lasts. Science says 100,000 volts, and you touch it once, even if it doesn't kill you, you will never touch that again. Punishment is effective. It's enormously effective, and it's immediate, and many of the procedures that have been used in clinical psychology, other than my own, have also found themselves using some mild form of punishment. Well, so I did a number of studies on that and tried different schedules of punishment and an alternative response situation, also different types of punishment, not just shock, but as I said, like I guess one of the first studies on timeout were those that I did. The timeout as an aversive stimulus, also, as I mentioned earlier, in a multiple response situation, that is with competing responses available. But one of the most exciting things that I found, I got to tell you about it, you haven't asked about it yet, is with the animal studies on aversive stimuli. I was doing, one of the things that I was totally unable to do with aversive stimuli was to shape behavior. As I mentioned before, I could have an animal in a chamber, and in 60 seconds I could have the animal trained to do a specific, any specific behavior that I wanted. When it came to shock, I couldn't do that. and that is if one used reductions in shock level as the reinforcer and try to shape behavior, the shock itself kept interfering with the behavior. It would elicit all kinds of respondents. The animal would get emotional, would get upset, and nothing would happen. Well, then I was preparing for a course over at Southern Illinois University where we both taught, and it was an evening course, and I was reviewing the chapter, and there was a picture in there showing two rats that were fighting, and it said that you may have seen, remembered it, right, that these animals had been shaped by shock reduction to fight, first by reinforcing them for slight movements toward each other, then more so, and then touch contact, and then hitting, then biting. I said, well, that's ridiculous. And here I got a lecture on that. I mean, that's the chapter I've got to cover. What am I going to, how can I do that with a straight face when my own experience says I can't do it? And so I still had a few minutes, something like 10, 15 minutes before I had to leave for my class. Remember, Anna State Hospital was about 20 miles away from the university. And so I took two rats from their cages and put them and hooked up a potentiometer, which allowed me to go into vary the intensity of the shock, and starting off with barely perceptible shock, and then try to decrease it when the animals move toward each other. And boom, I just increased it slightly, and they attacked each other. What? You can't do that. I haven't taught you to do this yet. And so something is wrong. So I went and said, well, maybe somebody was playing around in the lab, and they were doing something that I know about, and these are not truly naive rats. So I took another chamber, two animals that I hadn't even been assigned a number yet, and tried them out. Same thing happened. And this time do it more gradually. Maybe I did it too suddenly. And it didn't make any difference. How gradually I did it didn't work. And here I had to leave for class. And so there was a box there that just arrived from the animal supplier. It had these Sprague Dolly white rats in them. And so I knew that, and the box hadn't even been opened, so I knew these were naive. So I put them in and very, very carefully increased the level of the shock to make sure that I wasn't suddenly giving them a strong shock. Same thing happened. And so that's how I discovered this phenomenon of pain aggression. And that set me off on this very exciting program. That the question is it just with rats? Is it just Sprague-Raleigh rat? And so I had a zoo there. I chose all kinds of animals, animals that were known for their aggression. I had rattlesnakes there who had different types of aggression, not with biting. I went and I used electric eels. They attack by shocking. I got
an alligator, didn't you?
Huh?
Didn't you have an alligator at one time?
I had alligators because they do it with their tail. I had goats because they do it. And I tried it with all kinds of things, and also with monkeys and and I published some of that. And then obviously I didn't want the animals to be hurt, and so I managed to devise an artificial animal. So, for example, with pigeons, I had a stuffed pigeon as the target rather than live pigeons, so that I wouldn't be hurting the target of the aggression. Well, that was just so exciting. And what I did is I found that you didn't have to use shock. You could use any type of physically painful stimulus. It could be even a slight pinch or a thermal or anything. But most dramatic was time out. Time out. Sudden imposition of the absence of reinforcement was aversive and could precipitate aggression. In fact, remember I was telling you earlier that I had John Keller, Fred Keller's son, right, working for me one summer, and I set up the equipment and all, and I had the halting stage, and I had John put the animals in and run it, and he came back, and I said, well, what happened, John? You know, he was looking through and he told me, well, on the recorder, what it showed. And I said, no, forget about the recorder. You were looking at it. What did you see happening? And he said, they attacked each other. And, oh, God, I ran in there. And that was true of that, even time out, even versus stimulus. Well, we've all heard about the frustration-aggression hypothesis. What does frustration mean? It's an undefined thing. But here, this is very concrete. You had a flurry of reinforcers. There's food deliveries being given, and then they came to an abrupt halt and immediately attacking. Well, so, and that sort of thing I used in my studies, and that is you don't have an abrupt halt. You always have signal non-reinforcement. You have so that you don't have this sudden type of imposition of this, I hate to use the word, but anyhow, aversiveness that you have on on the pigeon. Well, so these experiments were going on at the same time. Yeah, the animal work was there. But then at one point in time, I did say enough is enough. We know enough about the animal, or at least I have enough now, and the big hurdle is applying it to human. Because there was one moment where I made a very conscious decision, and I published all these these studies, things on with animals, on its influence on aggression, and I remember I did studies on masochism, that is, with animals, that is, on how you could experimentally create something that looked like masochism. And I'm waiting for the world to adopt it and put it into practice, and it didn't. And it didn't. And I said, well, you can't wait. That if you want something to eventuate into practice, you can't stop at the animal study, you can't stop at the analog study, which I've done a large amount of. You have to use it in the situation in which it is going to be used by the people that need it. And at that point, I cut off all the animal studies very, very deliberately. That was a very conscious decision. I had the funds to do it and everything, but I realized that you had to do it. Let me do it myself, Mommy. Nobody was going to blindly say, well, here, oh, is that how you follow masochism? So now when I have somebody who's masochistic, then here are the treatments that I will use. That didn't happen. Or here's what's responsible for aggression. This is how one should treat it. It didn't happen. I started doing studies specifically on aggression. I started doing studies specifically on all of these other facets. Initially, I did a medication compliance study, and it was an analog study. And much later, fairly recently, only about 3-4 years ago, I did with actual patients, with outpatients from the mental hospital. And so that's been the general thrust. The animal work served as a foundation. It provided the specific rules to follow. It provided the broad conceptual orientation, and now plunge into the real life situation where that can serve as your point of departure, but obviously many other things are needed.
Punishment was a part of your early applied work, but your subsequent work appears not to have punishment.
Right, and that was partly, that's very perceptive, and that's exactly true, that once having seen how effective it is, and one can understand then why it comes so readily to mind as the first thing to use, that the idea that it's not effective is nonsense. It is so effective that it can not only be used, but easily abused, because it does have such an immediate, long-term, profound, generalized effect. But an underlying assumption really is that one would like to go into increase the general level of happiness of people, which conversely means reduce the distressing things in life, or translated conceptually, and that is to go into increase the magnitude and the density of reinforcement and decrease aversiveness. And even in those cases where Lovaas found shock so effective and without peer in eliminating self-injury, wouldn't it be nice if we could accomplish the same thing, or even almost the same thing, by using things other than that? And so using time out, using alternative responses, and that's what Lovaas did in the self-injury. After the shock suppressed the self-injury, then he had the child approach the attendant who actually delivered the shock and give a hug, so the child was receiving attention for that, building up that behavior. And so that's been a general theme, to eliminate the use of physical pain, or even pain in every other sort. So that's some of the procedures with child rearing, for example, where they actually do encourage a slap on the wrist or something of the sort. I want no part of that. That just too easily can blend into things that are inexcusable. And so I developed some other procedures, and the nicest one was this one on correction, self-correction or overcorrection. Let me tell you about that. That's a fascinating story. I was working with teaching profoundly retarded individuals to toilet themselves independently. And for those of you who aren't that familiar with the field, in the case of profound retardation, toilet training independently is usually absent. That the individuals are, almost by definition, they are nonverbal. That is not only no expressive language that is speaking, but often total absence of receptive language, usually paralysis or spasticity. They don't understand. You can't rely on instruction. So they were real in fact, what their former diagnosis was the untrainable. You had the untrainable, the trainable, the educable, and the non-educable, the educable. They were the untrainable. They were the individuals with an IQ below 20. So I was teaching them So I was developing this method of teaching them, and eventually succeeded beyond my wildest dreams, and that is the longest it ever took anybody to get them to toilet completely independently, without any reminders, without any prompts. They go by themselves, they wipe, they flush, they wash, they lower their pants. Was 1 week. That was the long. But there was one fellow who was an exception, and what he would do is, he was classified as profoundly retarded. I think he was profoundly intelligent. What he would do is, he would, even though he had learned how to toilet himself and could do it on his own, he would wait until shift change time in the institution when all of the attendants were gathered in the nurse's station, where there was a glass window so they could see out, and would deliberately urinate a very large volume of urine so that everybody could see him. Well, he obviously had bladder control because he'd retained it the entire day, so the teaching bladder control wasn't it. It was obviously, or apparently, very much under social control. So what could you do? Ignore? Well, they had been ignoring him, but you can't ignore a puddle. You can't leave it there. You have to do something. And try as you might, it's impossible to not give some type of a reprimand or admonish, or at least say, please don't do that. It's impossible to give no attention. It's totally unrealistic for somebody who has to clean it up. And the attendants would, of course, come and clean it up. So in desperation, without any conceptual notion of what I was doing, I said, well, at least we can ask them to clean it up. And we did, and the frequency of doing that went down. Oh, wait a minute. Why is that effective? And that's what I try to do when something is effective, try to analyze conceptually what's going on so I can make it a general case. And I said, that's the effort requirement. That's this thing that I had previously found in my studies in the Army, that effort is aversive, that in a very, very subtle, mild way. So have them clean it up. And we had them clean it up, and that reduced it to half of the frequency. Well, then if cleaning up a little bit of effort will reduce it somewhat, then a lot of effort will go and clean up all the way. And so I had him clean up not only that, but also the general area and tidy up around there, and it disappeared entirely. And so then I formulated this general principle on the basis of that, of self-correction, and that is, have the individual take the complete responsibility of correcting the situation, whether it was deliberate or not. You don't have to think about it. That rather than somebody doing it for them, and tried it out with aggression, tried it out with teaching eating. Somebody spills something while eating because of their sloppy habits. I tried out all kinds of things. And that's what led me to go into deal with self-stimulation. One thing led to another. That is, I said, okay, this thing seems to apply to everything that is functional, that produces some effect. Is there a limiting case to this principle of overcorrection and self-correction? And that is on behaviors that don't produce any type of environmental change. Then if there's no environmental change, then what's there to correct? And so there are some things that don't produce any kind of a change. Now, you might say, well, it's something like somebody who becomes a stripper, who disrobes. Well, that's no environmental change. Well, it is, because the effect is a social one. It has an effect on the audience. So what is it that really has no effect? Then, by definition, the word self-stimulation, behavioral stereotypy. And that's the kind of thing that you see with profoundly retarded and with autistic, that highly repetitive movements, like rocking back and forth, or going like this, going all day long. And that has no effect. So could it be applied to that? Because that seemed like that would be a limiting case. So that's how I began studying self-stimulation, simply because that seemed to be a limiting case of the kind of behavior that this principle might apply to. But then and that led to this other principle, and that is a positive practice. And that is that the way to apply it to that is not to correct, you can't correct, but rather to reinforce the alternative. The opposite. What's the opposite of moving your hand in a non-functional way? It's to move it in a functional way, and that is, Mary, right? Please reach out. Please raise your hands. Please, right? Hold them still. It's just not moving, but he's sitting still. So teaching the alternative behavior. And so again, you can see the commonality there, and that is to try to get rid of a negative behavior rather than using shock or any kind of aversive stimulus or reprimand or anything else. Go and use this general rationale of teaching competing or antithetical behavior. So one thing led to another, but once having developed it, once having gotten into that, I stayed with that. I didn't just do a demonstration study saying, here, this illustrates the validity of overcorrection. No, we tried it out with patients in a controlled situation and in a ward situation in a classroom to make it last all of the time. That had gone past the stage of analogical studies, but how do you do something? And so as a consequence, the final product was something that people could just use immediately. It wasn't that they had to use some kind of verbal or analogical or metaphorical extension of what it was. But here's the package. You can use it.
And here you did that with profoundly developmentally delayed individuals,
That was
and yet
exciting.
the same logic, teaching alternative responses, appears in your habit control work.
Right. Well, right. Let me tell you how I started that.
With
and
all
that's
kinds
the
of
same
typically
principle.
developing
The same
people.
principle. What happened is after having worked so intensively, working extensively on self-stimulation with the retarded, that we noticed one of the patients at the hospital was walking around with a head jerk. And at the risk of throwing my head out of whack here, it looked like this, where the eyes went all the way back. But that did hurt. And so, gee, that looks like self-stimulation that you see with the autistic and with the retarded. And I wonder if I could do anything with that. Well, of course, the procedures were entirely different because this was someone who was he was alcoholic, but there was no great
Is it
loss.
a staff member or a patient?
Patient.
Right.
And so there was no great loss of cognitive function the way there were or dementia as there were with the mental patient. And so what could you do? So it went and devised the procedure there and used a competing response. And that is, essentially went and had him, well, what's the opposite of doing this? Well, it's doing this, moving the other way. Of course, you do that, you're just substituting one anomaly for another. But it was to strengthen the muscles. Mm-hmm. And so it was essentially doing a turtle. That is, pull your muscles in, and there's the sternocleidomastoid muscles that pull your head in that way, and strengthen them, but to do it in a way that's normal. So taught him to do that, and looking at a mirror so that it didn't look unusual, and to titrate the amount of tension to the point where it was just enough to completely block that. And the way you knew you had the cure was, okay, now, while doing that competing reaction, I want you to deliberately try to induce that tick. And while maintaining it, and they say, I can't. Okay, now loosen it up a little. Can you now? No. Loosen it up more. Just get it just enough. That's what I meant by titrate. Well, and so now had him arrange that. Remember now, there's no more reinforcement, and there's no coercion. This person has to do it on their own. Whenever you feel that whenever you have that tick, I want you to do the competing reaction for 1 minute. So it's self-imposed. And here, this is that effort requirement, so that in a subtle way, it's acting as a negative consequence, but it's educative. It's strengthening those muscles that enables this individual to hold that in play. Well, and also to, if you have the urge to do it, or even the thought or a precursor, do it. And so so you can say I was also using imaginal stimuli. There was nothing that was completely behavioral about it. The object was to get rid of that tick, and anything that you can think of that's going to lead to 100% effectiveness, do it. And analyze if it does work in an isolated case, how you can generalize it. So I had them, even if they had the thought or the tingle or the feeling, anything, or even if it was the situation, they tended to do it in some situations more than others. But whatever it was, cognitive, affective, physiological, a feeling of tenseness, use that as the signal to you to initiate the competing reaction, and then it'll stop it. And what happened is you didn't have to go through life using that competing reaction. After having done that for a while, the urge stopped occurring. It was gone. And that's one of the most exciting things. When people come in with a tic or with Tourette, which is considered to be a purely medical problem, and that's just so exciting. They walk in with that, and at the end of the day, they're not doing it. And you tell them, I want you to deliberately induce it, and they can't. And that's just so exciting. It's a whole different world from doing basic research, where you're working at a very abstract level, but in the way it's built on the foundation of the basic research.
One of the things that I've always found fascinating about you is your passion for what you do, and it's clearly not diminished slightly. Let me ask you some field-related questions. What do you make of the cognitive movement in behavior therapy today?
It's an empirical question. Many people approach it as a philosophical question. I see it as an empirical question. To what extent do cognitive factors play a role causing it? That is, are they determinants, or on the other end of the equation, is it important to go and to measure the cognitive changes, the dependent variable? I don't see that as a cognitive revolution. I've been doing that all the time. One of the first things I did when I worked on developed behavioral procedures for what I call reciprocity counseling for improving people's marriages. My outcome measure was marital happiness, and I developed a marital happiness scale from 0 to 100. There was no question about it that your subjective response is an important, or one of the most important dimensions of the outcome, that however effective, whatever your marriage is, however your husband or wife is doing for you, if you're not happy for whatever reason, that's important. That's crucial. And so, in fact, in the initial study I did on that, I didn't even bother taking any behavioral measures. It was so obvious that the happiness was the important. So that part's no problem. And I'm not the only one who did that. Joe Walpe, many, many years before people who use the word cognitive psychology, he developed imaginal rehearsal that as a procedure. And also, he was the one who, to my knowledge, first developed quantitative methods for quantifying the extent of the subjective reaction. His SUD scales, subjective units of distress, which he applied to any kind of distress. And so he was a pioneer on that. He didn't have any problem. People consider him to be one of the primary behaviorists, Pavlovian-type behaviorists, and doesn't deal with subjective things. He not only dealt with them, he quantified them. He made them the primary object of the treatment, and that is how low could he drive the SUDS level down for people who were very anxious or phobic or distressed. And so he had that right in there in the beginning. In terms of that's on the response end. In terms of the treatment end, he always had the imaginal in there. You had the person recreate in their imagination the scene that was distressing to them, arrange it on a hierarchy, and recreate all of the scenes and keep thinking about it until it's as real, seems as real imaginally as if you were there. And so he always used that at both ends. He used it as the independent variable, and that is how you go about obtaining the ultimate clinical change, and he used it as the dependent variable, and that is what is the clinical change. And so there was no big thing. I didn't invent that. I didn't know about Walpe's work at the time that I did it, but it's, again, the same from my own perspective. I looked at the problem. What is the important problem? Forget about proving a theory or anything, even though I got the original idea of working on that problem from Dick Stewart. He published the first article on that. It was pioneer. It was brilliant. And opened up the door much the same way as Ted Ione's work with the psychiatric nurse opened up the door to that. Well, so it's how do you improve the marriage and whatever else is involved, and of course in many areas there is nothing else or almost nothing else except this subjective dimension. For example, in studying pain reduction, that is your primary variable. I mean, everything else is extraneous or is just incidental. You want to reduce the pain, and so you do that. So I can't see the sense in that. I notice in seeing many of the other wonderful studies that have been done to answer the original question of that, as to just to what extent are the new procedures that are being used in cognitive psychology, they've been empirically supported as adding anything to what could be done with much more simplistic and more objective variables. And there were recent studies that I've seen on that. I know there's one that Neil Jacobson was involved in, and some of the foremost cognitive psychologists were involved in, and they compared very elaborate kinds of cognitive procedures and challenging your underlying axioms and cognitive restructuring, and they compare that in treating depression with simply priming competing positive reinforcers, right? And the kind of thing that Pete Lewison pioneered in the study of that, and follows from what I've been talking about, the importance of competing behavior. And so it's a question of what follows first, the thought or the behavior? Does the behavior follow the thought? Does the thought follow the behavior? I think it's a mistake to talk about choosing between them. They both cause each other, and just as in the case of the habits on the tics, you have the person react not only to the actual tic when it occurs, but to the thought, the feeling, the affect. You give all of that. So, but the word cognitive, it has an air of political correctness about it. If you say your behavior, it has a terrible connotation. You say, oh, he's a behavior. Oh, yeah, everything's fine except his behavior. There's a connotation of the word behavior, that you're talking about behavior problem. Oh, he has some major behaviors. And so the word behavior has these connotations. Cognitive behavior, that sounds fine. And so to me, it's a matter of terminology, and I see no great advance that is made above and beyond what we were already doing, and to the extent that they are doing anything different, as in this challenging axioms, that has not been empirically supported.
You won an APA award for distinguished contributions and applications in psychology. In your acceptance address, you charged the field with conducting large-scale, large outcome studies. That was over 20 years ago. Do you feel that we've accomplished that to any degree?
Well, that's very knowledgeable of you to go to remember that esoteric. It's wonderful to know that somebody actually reads these things.
I was there.
Well, we followed each other's work so closely that I'm being, of course, facetious in large part. On the plus side, which, of course, the only way a behaviorist looks at things, I'm just delighted with how the field is going. In terms of how far it's gone, that's something else. That is, it hasn't yet gotten there as much as one would like, but it's going the right direction. If you go and you apply for any of the federally supported grants, or you submit an article to any of the major professional journals, it's wonderful what the criteria are now. And that is, if you claim efficacy for something, then you must have an experimental design. You must use statistics or use quantitative methods or whatever, ABA design, whatever it is, but it must be some type of strict methodology. A straight weightless control, which is what we all used beforehand, that is treatment versus no treatment, ABA, AB. That's primitive. That's primitive now, because we know so well now that many of the contextual factors surrounding treatment can be responsible for it, and not the specific components that were believed to be effective. And so you must run some alternative treatment, the equivalent of placebo control in medicine. And that is some type of method that does not have the ingredients that you think are essential. And for the same number of sessions and the same amount of time with the same selection. And then the marvelous criterion of treatment integrity. That's just fantastic. That's become essential. That not only say that you did behavior therapy or cognitive therapy, but to what extent did you do exactly what you said you would do? And as, first of all, have a standardized treatment, and secondly, did you have any independent measures that you really did it? That's not novel. Kurt Lewin did that, and that's why I was so excited about his work way back in the 30s, that he did studies of democratic versus authoritative, but he didn't just tell the people to go in and act authoritative and democratic. He had independent observers who scored. How many commands did they give? How many requests? How many approvals? How many reprimands? And what he found, of course, is that what he thought was separate, authoritative versus democratic versus before, the overlap was enormous. Imagine if he hadn't done that. We'd make these generalizations about that, and in point of fact, the people who were democratic, they were giving all these commands and peremptory criticism. Now that's the field in psychology, and that has become the standard. Not universally, but that's where they're going, and that is just so gratifying. And what's especially delightful is the behavioral psychologists set the pace on that.
Right.
I mentioned Kurt Lewin as a specific example, but that's what behavioral psychologists have always done.
I could listen to you forever. I think our time is winding down. You've been a visionary. What visions do you have for the field in the 21st century?
I think it's wide open. I'm just so jealous of the younger people now. First of all, I'm jealous because they're brighter. I go and I read their essay questions and their thing, and it's incredible. Their fund of knowledge is just enormous. I feel so jealous of them for all of the information they have about treatments that do work. And I'm jealous of them that we do now that this rigorous methodology, and that what's to me the most important thing in the world, and that is a science-based psychology. And that to me is the driving force. That's everything. Do it. Outcome studies. That to me is the most important thing. Forget about the theories, the history, the speculations, the differences between the statistics. Those are all things that are fluff in a way. What's important is what helps the person. And I think that part of it is just wonderful. I'm delighted. Behavior analysts, they've made incredible progress in the areas of retardation, school behavior, autism, institutional situations. They're all, in fact, they've defined the field. There is no competition. They are the field. It isn't, should I be a behavior analyst or not? If you're working with retardation, of course you're a behavior analyst. similarly, in terms of outpatient therapy, the AABT, if you're an outpatient therapist, of course you're a behavior therapist. There's no other show in town, right? That if you look at the studies that have been done, that have been validated for effectiveness, that's it. So you can't say you're a dynamicist. If you're committed to science-based treatment, you want the best for your patients, and you have any integrity yourself in terms of delivering to the people who are paying you for services the best that the world has to offer, then of course that's what you're going to do. And so you'll be a behavior therapist. If you work with retardation or school, you'll be a behavior analyst. And I think that's really the important thing, that you don't have to be a speech therapist like I developed methods for treating stuttering. You have to have a license in speech therapy to go in to do that, and legally you may, but if you want the best for your patient, that's what you will use. And if like the token economy just said right in the very beginning, to come full circle, but of all of the private and state psychiatric hospitals I've seen that deal with youth in particular, all of them use the token economy. They don't call themselves behaviorists. Of course they be. And that's good. Never sell them on it. When I wrote that toilet training book, I was careful never to use the word reinforcement, stimulus, discrimination, generalization, nothing. You only had one task, and that is you want to teach your child to be independent.
What a great wrap-up. This has been as enjoyable as I thought it would. Thank you so much, Nate.
Well, it's my pleasure. This is really just a continuation of the conversations that we've always had, and the kind of things that we've been talking about. I mean, we should be reversing seats. The kind of things that you've done in treating child abuse and neglect, they did the same thing. You put together, you use behavioral principles and learning principles as the background, but then you did whatever's necessary, and it turns out neglect is there. And you're dealing with the parents. Well, that's not abuse. You're not teaching people to not be aggressive or hurtful. And so you went ahead and you developed all of these ingenious procedures for identifying it and all, and adapted them to the situation, but using these same principles that make sure you have a standardized methodology, you've defined what the goals are that you want for the parents, that you've found the reinforcers for the parents, and you've hooked them, and you've tied them together with what it is that society demands of a parent, namely to go into care in a responsible way for them. And your procedures are just so widely used. You have a large organization now where you supply these training for abused and neglected children. You were telling me in the state of California and in Illinois, you did it for a large segment of the southern Illinois area. And so a good product sells itself. Psychologists should never worry about, well, how do I get society to adopt it? If it's good, you can't stop them from adopting it.
Great. Thank you.
Right. Well, it's my pleasure. Good. And I look forward to continuing this discussion, of course, after the video camera goes off. I hope that you'll be staying around here for a while. You'll be staying around.